A local hospital was the site of some international attention today. It all started earlier this year when a Sarasota orthopedic surgeon spoke about a hip replacement procedure at a doctor's conference in Japan. Some Japanese physicians were so impressed by his presentation that they decided to travel here for a closer look. We were in the operating room for the procedure, so we do want to warn you that this story does contain images of surgery. SNN Local News 6 reporter Grant Boxleitner has more on this story.
Dr. Edward Stolarski has performed hundreds of hip replacement procedures using a minimally invasive technique known as anterior supine intramuscular, or ASI.
Went to the Cleveland Clinic and kind of, in my hands, perfected it. And for the last 4 or 5 years, we've been teaching it first nationally and now internationally.
Stolarski doubled as an instructor Thursday at Doctors Hospital in Sarasota. 6 Japanese surgeons traveled here to study the ASI procedure, desirable because there's less trauma to muscles and tissues and has a smaller incision than traditional methods.
The highlight of this approach is we're able to be more accurate. They're on their back instead of on their side for the surgery, so everything's more accurate, their anatomy is more stable.
ASI is not so popular in Japan, so I want to learn how to do it and how to do it safely.
For patients like Victoria Denisi, doctors say the ASI approach means a quicker recovery time, more flexibility, and less chance of dislocation. Stolarski says she could be walking in a week, driving in 2.
I think it's a great procedure. I know they've come a long way, and I waited too long to have this surgery. Now that I had it, I'm sorry I waited this long.
Even 10 years ago, you would be 3 days in the hospital. It'd be about an hour operation, 3 days in the hospital. You couldn't cross your legs. You had to sleep with a pillow between your legs, and you couldn't bend past 90 for 6 weeks.
Dr. Gaku Koyano says he's looking forward to soon giving his patients back home the ASI option.
Less bleeding and less pain and lesser operation time, and he can walk easily after the operation.
Stolarski says he's honored to teach what is quickly becoming the preferred way to replace a damaged hip joint.
I think it's really been worth their time. They're very, very gracious people, and I learn as much from them as they do from me. They don't know that, but it's a two-way. It's a two-way street.
Reporting in Sarasota, Grant Boxleitner.
I think it's a miracle, and it's great.
SNN Local News 6.
Dr. Stolarski performed 4 hip replacement procedures in front of the Japanese doctors today. He's a member of the Kennedy-White Orthopaedic Center in Sarasota. He says he learned the ASI technique 7 years ago in Belgium.